everyone. I hope you are all well. Unfortunately, according to the World Health Organization, WHO, and according to the latest statistic, there are approximately 235 million people around the world severe from asthma. And asthma is a significant cause of morbidity and mortality around the world. It is responsible for approximately 400,000 deaths each year. And asthma also is the most common non-communicable disease among children. It is estimated that around 14% of children worldwide have asthma. So, what is asthma? What is it? It is symptoms, and how what is the treatment, and how to avoid the infection. All of this we will discuss in this presentation. So my topic is asthma, and my name is khairuddin Nofal Muhsin. In the begin, what it is asthma? What is asthma? Asthma is a condition in which your airway become narrow due to the contraction of muscle of a smooth muscle that's surrounding your bronchioles and swell and may produce extra mucus. Actually, this condition usually accompanied with inflammation. So all this factor will cause decrease of airflow in the airway and coughing, wheezing, and shortness of the breath. Asthma cannot be cured, but its symptoms can be controlled. So asthma often change over time. So it's important that you and your doctor design a plan to track your symptom and treatment and adjust treatment as needed. What about symptoms? Asthma have several symptoms that vary from person to person. Some people have can have symptoms all the time, or have symptoms at certain time, such as exercising. Asthma symptoms includes difficult breath, wheezing, chest pain, sleep problem due to frequent coughing, allergies, common cold, and finally feeling tired. Asthma also have several causes and triggers that may increase the probability of asthma attack. So you should stay away from them as much as possible. So let us take a look about causes and triggers of asthma. Causes and triggers of asthma include pollutant and irritant of air, smoking, household chemicals such as cleaning chemicals. Asthma can be a genetic disease. In addition, fatty food, dust mite, pet dander, and also bacteria and viruses infection. Actually, asthma can triggering by some medication such as beta blocker, aspirin, and non-steroidal anti-inflammatory drug. In medicine, we use a short-acting rescue medication called bronchodilator. This medication causes your airway muscle to relax quickly and provides symptoms to relieve within a few minutes. We usually use an inhaler, which is a small device contain a drug such as bronchodilator to open your airway. This inhaler divided into two types: reliever inhaler and preventer inhaler. Reliever inhaler, we used them when we needed to quickly relieve asthma symptoms for a short time. Preventer inhaler, we use them every day to prevent asthma symptoms happening. That is necessary to mention that there are some drugs that cause increase in heart rate and shortness of the breath, thus exacerbate the condition. This drug is any drug contain dextromethorphan or codeine, dextromethorphan or codeine, such as bronchophene. So this drug should be never taken by asthma people. Finally, the prevention. While there is no way to prevent asthma, you and your doctor can design a step-by-step a plan for living with your condition and preventing asthma attacks. And here are some devices that will help you to do that. Firstly, follow your asthma action plan. With your doctor and healthcare team, write a detailed plan for taking medication and managing your asthma attack, and be sure to follow discipline. Secondly, get vaccinated for influenza and pneumonia. Staying current with vaccination can prevent flu and pneumonia from triggers asthma attack. Identify and avoid asthma triggers. Find out your causes or worsens of your asthma attack and take a step to avoid these triggers. In addition to identify and treat attacks early. If you act quickly, you are less likely to have severe asthma, and we will not need as much medication. Finally, take your medication as prescribed. Don't change your medication without first talking to your doctor, and your doctor can make sure you are taking medication in correct way and in a suitable dose. In conclusion, asthma is a widespread chronic respiratory disease that affects millions of people around the world. But don't worry, with the proper treatment and managing, people with asthma can lead full life and healthy lives. In the end, thank you for listening. I hope you enjoyed in this presentation and you benefited.